Here with news that the FDA is likely to approve so-called these mix and match combinations, Dr. McGeorge.
Yeah, Kimberly and Evan. So both the New York Times and Washington Post are reporting that soon the FDA is expected to approve use of different combinations of booster shots, regardless of which vaccine a person received initially. Now, this is after data on an ongoing NIH study of mixing and matching initial vaccines and boosters was presented at last week's FDA Vaccine Advisory Panel meeting. Whether a matter of convenience, an unexpected reaction to their first vaccines, or concerns over the coverage their initial vaccine may have produced, many people want to know if it's okay to get a different vaccine for a booster. The NIH has an ongoing study to at least answer whether doing that is safe and whether it produces a good immune response.
And the questions are, can one vaccine be used as a boost to a different vaccine?
So far, the answer to both of those questions appears to be yes. In the study, groups of people who received either both doses of the Pfizer or Moderna mRNA vaccines or the single-dose Johnson & Johnson vaccine were then given one of the three vaccines as a booster after 12 weeks. After 14 days, antibody responses were tested in each of the groups.
The heterologous had as good or higher neutralizing antibodies following the boost at day 15.
Translation: if you received a different booster shot than your original vaccine, your level of antibodies went at least as high or higher than if you received a boost of your original vaccine. Although the study was not designed to compare responses between groups, the most pronounced response was in people who initially received the Johnson & Johnson vaccine, followed by a Moderna booster. Their neutralizing antibodies increased 76-fold, partially because their antibody levels started lower to begin with. But even for people who received the Pfizer vaccine followed by a Moderna boost, the response was 32-fold. Now, it's important to note, the Moderna boosts given in this study were the full-dose shot, not the half-dose Moderna booster being considered by the FDA. Now, as far as safety for any of the combinations of an initial vaccine and different booster,
and there were no significant safety concerns identified within this short time period.
Now, right now, there is no official authorization to administer a different booster from the original vaccine. Now, I know some people are getting different shots by simply not telling the truth about which vaccine that they received originally, but that creates the problem that you'll then need two different vaccine cards. FDA authorization will make the process legitimate and allow for more flexibility. Back to you.